Hello and welcome to Maiden's 9th Sharing and Learning MHST webinar. We're just waiting for a few more people to enter the call and then get going. If you could make sure you're on mute at this moment, there'll be an opportunity to unmute later in our Q&A session. And our guest speakers are very much looking forward to taking your questions at the end of the presentation. I'm Jen, this is Martin.
Hello there.
We're part of the Maiden team today. We've also got our colleague Helen, who will be introducing our guest speakers once a few more of you have joined. We'll just give it one more minute. While we're waiting, just a few house rules. We are recording the session today so that we can share it with you later. If you don't wish to be seen, please keep your camera off. If you would like to rename yourself to include the name of your service or any pronouns that you use, you just have to click the 3 little dots, which should be in the corner of your screen near to your name. And we will be dropping lots of useful resources into the chat channel, but don't worry if you don't get a chance to record them all. We will include those in the email later, along with the slides from today and anything else that's mentioned. Martin?
Okay, there will be a Q&A session at the end of the presentation. So if you've got a question for our panel of speakers, please pop the question in the chat function, which is on your dashboard, and I'll collate those questions in the background. Now, depending on how many questions there are, we may be able to let you ask them individually, but if there are lots of them, my colleague Helen will ask them on your behalf at the end of the session. So without further ado, I'm going to actually hand you over to my colleague Helen. Over to you, Helen.
Lovely. Thank you, Martin. Good morning, everyone, and welcome to our webinar with Nottinghamshire MHST, our guest speakers for today. So we're really pleased to be hosting this webinar for anybody who's working in MHSTs and others who are supporting mental health in education settings. I'm Helen Barnes from Maiden, and I work in the marketing team here with a focus on the challenges and opportunities for children and young people's mental health services, particularly around data and technology. I'm going to be handing over to our guest speakers from the Nottinghamshire MHST very soon, but first I'd like to very briefly introduce Maiden for those of you who don't know us already. We're a software company driven by a mission to create digital technology that changes what's possible for clinicians and patients, and our app to CYP system is used by NHS trusts, national and local charities, for their community mental health services for children and young people, and there are a few examples of our customers on the screen here. Our system is a patient management system that can help you to manage referrals and session notes, and it can be configured to individual care pathways as they evolve. So there's a few information points about the system on the screen. But we're finding that our customers are having increasing numbers of neurodivergent children and young people who are seeking mental health support from their teams. And they want to make sure that their services are more inclusive and potentially adapt their care pathways to support them better. So we're really pleased to be hosting today's session on this topic. The team from Nottingham MHST are going to speak for about 20 minutes, and then we'll have 10 minutes when we open it up to your questions and some discussion at the end. So as Martin said, please post your questions in the chat channel at any point during the talk, and we'll try and collate those. We're expecting questions, so please, get them in the chat early so that we can get them asked to our guest speakers at the end. And as Jen said, we'll be sharing all the slides and the resources, and we're also recording this session. So if you'd rather not be on the recording, please keep your camera switched off and your microphone muted. So today our guest speakers are Naomi Williams and Jude Edwards and Lucy Fielding, all from the Nottinghamshire MHST. It's run by Nottinghamshire Healthcare NHS Foundation Trust, and the team are going to share their experience on how MHST delivery can be adapted and developed, and they're going to share some advice on reducing anxiety for young people who are presenting with a neurodivergence. They're going to be sharing their tips and some resources to help other MHSTs to consider their own responses to the growing number of children and young people who are seeking support. So I'm delighted to hand over to them now to tell you more about themselves and about their work. So if you'd like to share your slides, guys.
Hi, good morning. Thank you. Thank you to all who have attended today, but also to Helen, Jen, and the team for inviting us along to deliver this webinar. It's a really great opportunity for us to be a part of, but also to be able to share good practice. And I'm sure there's a lot going on across the country as well. So it'll be good to hear the questions and comments and just have a conversation really with you all. So as has already been said, we're from the CAMS mental health support team in Nottinghamshire NHS Trust. And what we're going to be kind of covering today is a bit about, SEN, neurodiversity, neurodivergent, some information on some research that I'm doing currently as part of my PhD project, and current methods and adaptations that can be used and what we plan to do in the future as a team as well. We're still a very new team, so we started, I think, probably about 2.5 years ago. So we're still very new in terms of MHST and the support that we offer. But the wealth of knowledge and experience in the team is brilliant. It's amazing. And that's attributed to all the clinicians and the management in the team as well. So what I'd like to do is go through kind of introductions, if that's okay. For those who are not aware, the mental health support team is a collaborative service that is across health education, and it's in schools across Nottinghamshire for us, but we know that that's, countrywide. We offer an early intervention mental health and wellbeing service in schools that's aimed at supporting children and young people and their families through low-level emotional wellbeing. And this could be interventions around anxiety, low mood, managing emotions, and sleep. We also are linked directly into Nottinghamshire CAMS, so we do have that link because we're based in the CAMS Trust, and we provide sessions that promote positive mental health, also for staff wellbeing, as well as the whole school. We offer training as well, which is an additional part of the service, and we do try and develop our whole school approach to make sure that mental health is, everybody's responsibility within the school. So for myself, I am a clinical specialist in the team. So I kind of support and supervise our specialist practitioners within the service. And my background is in social work and special educational needs. And I've also authored in a few books around social stories and social learning toolkits for children and young people with additional needs. I'll hand over to Lucy, who can introduce herself.
Hi, my name's Lucy. I'm a specialist practitioner within the team. So I do some one-to-one work with young people. I run groups for young people and parents, and I'm also sort of involved with like workshops for staff, parents, whole school approach stuff as well. So I do a little bit of everything. My background is I'm a mental health nurse. And I've worked in CAMS since qualifying. Sort of the early intervention, like mental health stuff, is something that is my passion. And sort of over the past year or so, I've learned so much around sort of neurodivergency and SEND, and it's a real interest for me. So I'm really enjoying sort of delivering this stuff as well.
Thanks, Lucy. And Jude?
Morning, everybody. I'm Jude Edwards, and I'm an education mental health practitioner. We've been working in the Broxtowe area for a couple of years now. So my background, I came from a secondary school before I completed my training. So I'm very well aware of the challenges that schools face, trying to meet everybody's needs and trying to look after the students as well as the staff. So I know what a juggle it is. I'm really passionate about neurodiversity. I have lived experience that my son was diagnosed autistic. So I've got a kind of I've got parent hat as well as practitioner hat. So it's really important that we sort of share our experiences and the successes as well as the challenges, because you get both along the way. So it'd be good to talk to you a little bit more about everything today. Thanks.
Thanks, Jude. I guess wanting to start, I'd really love to just share what I love most about the mental health support team in Nottinghamshire, is that they've seen a need and they've developed in terms of their staffing team and the backgrounds and experience they have. So what you would typically get with a mental health support team is the team lead, CBT therapists and supervisors, and then educational mental health practitioners. And the model is very much delivering a CBT informed approach to mental health and well-being for children and young people. And this is an early intervention service, so it all is around low level mental health presentations. But what I love is that with our team, the team leads were able to see that there was a gap in terms of service need and provision due to the referrals that were coming through and the needs that were there. And so then developed the staffing team to include specialist practitioners who are from allied health profession backgrounds, which could be, you know, OTs, nursing, mental health nursing, social work, and more of the creative therapies. And then also developed to have a clinical lead specialist in the team as well, which I think helps to support in terms of those creative ways of delivering the psychological therapies and showing they're still evidence-based, but that we add on those adaptations in line with the NICE guidelines. So that's something that is definitely something to be proud of in terms of the team and kind of the developments they've made over the last couple of years. So as we know, with SEND, it's children and young people who are up to age 25 and they have a special educational need or a disability. This could be a learning difficulty or a disability that kind of makes things more difficult to learn or to progress at the same rate as their peers or their counterparts. And a lot of this information is in the SEND Code of Practice 2015. And so I will summarize most of the background just to give us that foundation, and then we'll go on to the adaptations and areas of good practice. There's a term that we kind of hear a lot, is neurodivergent, neurodiversity, neurodivergence. And with neurodiversity, it's a word that's used to explain the unique ways that an individual's brain works. Everyone's brain kind of develops, but no two brains function the same, as you will know anyway. But being neurodivergent, it just means the brain works slightly differently from peers. And so this you typically would include those who are diagnosed as autistic or who have Tourette's or tics, attention deficit hyperactivity disorder, and then you have the other learning disabilities or intellectual disabilities and needs. But with everything, even though we are going to go on to talk about what works for us, there's no one size that fits all. And so this is advice and guidance and strategies that might work, but it's really important to get to know the child, you know, their needs, their triggers, and what they like. I think if you can build a relationship with a child or a young person and understand them, get to know them and help them to know that you're interested in who they are, then you're more than likely going to be able to make progress and develop and support them. So at the moment, there's over 1.5 million children and young people in the UK with a SEND diagnosis. And there's approximately 190,000 children and young people awaiting a diagnosis as well. And we know that children and young people with an additional need or diagnosed disability, they are 4.5 times more likely to experience a mental health presentation than their peers as well. So it's really important, I guess, again, and I can tell by the amount of people that have signed up today, the professionals, the clinicians, the key decision makers that have signed up for today, that it's really important we're having this conversation, we're discussing it, and we're creating the platform to be able to move forward and share good practice, really. And so what I'd like to do, I guess, for me, as I said in the beginning, my background and my core profession is social work. And there's something that I remember being hammered into us from the beginning of time, and you've probably all heard it, safeguarding is everybody's responsibility. I would like to get to the point where we're saying SEND or whatever term, you know, neurodivergence, additional needs, inclusion is everybody's responsibility. And that's definitely an ethos that we foster in the mental health support team in Nottinghamshire CAMHS. I can remember, and this is linked into kind of like how children are affected by, I guess, their needs, but also how it affects the environment around them, and kind of how we can make adaptations. But I can remember supervising a clinician who shared their concerns about a young person who had been kind of referred. They had ADHD, and they also had autism. And this young person struggled during the assessment to sit down. So the assessment was completed within an hour, but it was in that time that young person paced up and down in the room. And the clinician was really concerned because they didn't know how they were going to kind of use the interventions that were planned to be able to support this young person with their anxiety and their behaviours that challenged as well alongside that. And so we kind of discussed creative ways of doing that. And I said, well, does it have to be, in the four walls? I know normally that's how it goes. You're in a room somewhere delivering a psychological therapy or intervention, but is there any way that we can use the same principles, the same psychoeducation or whatever it was, and adapt that, make those adaptations to ensure that that young person can actually get the best out of it and the most out of it. And so she went away, looked at what kind of was planned and how she could do it. And the next time we had supervision, she came back and she was smiling, she was so happy. And she explained that she had been able to take that young person outside. It asked for the permission of the school, so took them into the actual playground and was able to say to that young person, right, we're going to learn about how to manage our emotions and regulate kind of, what's going on. So when you are feeling angry, this is what your heart does. And she was trying to explain, the psychoeducation around fight, flight, and freeze. And so what they ended up doing was she made the young person's heartbeat quicker by they just ran in a circle and kind of shouted out keywords and just made it really fun. And then she got him to stand still, and he placed his hand on his chest where his heart is. And she said he literally lit up and he said, oh, I get it now. And it was just a really key moment for her. And after that helped her to, she then started channeling kind of like that passion for SEND and supporting them in mainstream, low-level early intervention mental health services, and became kind of an advocate for that. So it's just an example, a small one, of how we can still, work with children and young people, even in our mental health support teams who have additional needs, who may find it quite difficult to focus in a room with a table, but just by using adaptations as well. And that helps, in terms of kind of going from the whole equality all the way to actually giving people that sense of belonging, really, within, our wider society, community, in our schools, in education, and also in clinical practice. And that, we know as the Equality Act 2010, it also covers having kind of like a mental health presentation, and the needs that covered under there are, related to anxiety, low mood, panic attacks, and so on. But I'll leave that for you to read. The slides are available at the end to go into much more more detail on those. So what I'd like to do is share a PPI video that was created. So as part of my research at the University of Warwick around autism, intellectual disability, also known as learning disability, and clinical practice, we have a group of PPI members who discuss. These are children and young people, parents and carers, who've kind of shared this is how they would like the research to be presented, the proposed research that will be over the next 3 years, and hopefully in CAMHS trusts around Nottinghamshire and the wider areas around the country as well would be amazing. We do have a lot of CAMHS trusts that have already verbally said that they are interested in this. But why we're sharing it today is because it links very closely with our early intervention service. And for me, the question is always, why not? Why not, in terms of support and what we can do in clinical practice to support as early as possible to reduce those health disparities for children and young people with additional needs as they go on through later life as well and into adulthood. So I'll let Lucy share that now. It is easier to hear if you have headphones, but the link will also be shared and is on the screen as well. Thank you.
Hello, my name is Naomi and I'm a clinical specialist at the CAMS mental support team in Nottinghamshire NHS Trust. I'm also currently completing my PhD studies at the University of Warwick under Dr. Helen Foreman and Dr. Hayley Crawford in the Warwick Medical School. I'm currently on the Mental Health and Neuroscience PhD programme. My role when in clinical practice is supporting children and young people who have mental health difficulties and also those who possibly have additional needs as well. What I've found when in practice is that there are different ways that children and young people need to be supported, and this can often be with adaptations to psychological therapies or using a creative approach. I've always thought that there's more to what I do in clinical practice, and there's questions that I have, and so I've gone down the route of figuring out these questions and maybe exploring and finding some answers by answering them through research. Research is something where you look and you look again, so you re-look to find maybe the issues, the cause, or maybe even explore some answers as well, and see what other people have written about the same subject or found. Typically what the issues are in terms of the role that I'm in is there are children and young people who may have autism or an intellectual disability known as a learning disability as well in some areas of clinical practice that are not able to access mental health services. This could be because of various things, but typically it may be because their additional need is seen as more of the reason why they're having a mental health difficulty, and so they're signposted to other areas and other specialist services. So I came up with this idea of the AD study, which stands for Autism, Intellectual Disability and Clinical Practice. The objectives in this study are to, number one, explore experiences of children and young people, those that are autistic or who have an intellectual disability, in mental health services in England. To investigate, number two, the effectiveness of psychological therapies for these children and young people. And number three, to recommend effective referral and mental health support interventions for children and young people who are autistic or who have an intellectual disability. Autism is known as a cognitive need. It affects social interaction and communication with others. Usually this is quite difficult for children and young people who are autistic. Whereas an intellectual disability can affect the ability to learn and to function in daily life. One to 3% of children and young people who are autistic or who have an intellectual disability are also more likely to have a mental health condition. This is at 4.5 times. And nearly 100,000 children and young people with mental health and disabilities also had contact with mental health services in the year 2021 to 2022. Although there's a high number of autistic children and young people and those with intellectual disabilities referred to CAMS for mental health difficulties, they are typically signposted to specialist disability services rather than accepted for psychological therapies. And there's not much research around why this happens in community mental health services for children and young people with additional needs. And the research that is there mainly focuses on the views of parents or carers, or the views of children and young people in inpatient mental health settings. My theory is that there is possibly a lack of confidence, training and adaptive psychological therapies to allow clinicians to effectively work with autistic children and young people, or those children and young people who have an intellectual disability. There is also the common assumption that poor mental health is a symptom of autism or intellectual disability, and not a mental health difficulty needing an intervention in its own right. However, as we know, autism presents as social difficulties, whereas symptoms of anxiety are low mood, including worry and irritability. Additionally, lack of involvement from autistic children and young people and those who have intellectual disabilities have resulted in unmet needs, inappropriate psychological therapies, and a barrier between children and young people, families and mental health services in England. Some of the current processes and pathways in CAMHS are not appropriate for autistic children and young people or those with intellectual disabilities, which can create even more barriers to accessing the service. So I'd like to use this opportunity to answer 2 research questions. What are autistic children and young people or those with an intellectual disabilities needs and experiences, using narrative interviews with 25 children and young people with support from their parents or carers, where they can share their stories and views of experiences in mental health services and with mental health difficulties. And I'll look at the key themes and analyse. Secondly, I will research how competent are CAMHS clinicians in assessing their needs during triage and treatment of psychological therapies, by creating a mental health provider survey for at least 100 CAMHS clinicians to complete across England. I'll analyse this and the response as well. I'll bring both the results together and then use this to decide what is important to discuss in focus groups in step 3. The focus groups will be with commissioners and managers in CAMHS, and there will be 6 groups in total. I'll look at all the main areas that are discussed and then re-look at the results from the narrative, children and young people's interviews and the mental health provider survey. All the findings will be shared through tables, pictures and key quotes. I'm hoping to create the opportunity for autistic children and young people and those who have an intellectual disability, along with their families, the platform to share their stories, influence referral and psychological treatment pathways, and recommend training to improve practice in CAMHS. If you have any questions or comments, please email me at naomi.williams.1@warwick.ac.uk. Thank you.
Thank you for sharing that, and I'll hand over to Lucy now, who will speak a bit around adaptations.
Hi everyone. So now I'm just going to talk a little bit about some of the adaptations that we recommend, sort of mainly within school and education settings, but I guess the ideas and the principles behind them sort of relate to all of our clinical practice as well. So one of our colleagues, Martha, had done some work around universal design for learning previously, and this is something that you can sort of we've got some links that you can look up online, but basically it's about making learning materials accessible. So part of this is multimedia learning, so using different types of media within learning to meet different people's learning needs. There's some quite simple things we can do, like using darker backgrounds and lighter fonts, uncluttered slides, which have like key terms in bold. So these all sort of relate to the communication aspect within a classroom or education setting. Part of the things we recommend that I'll sort of talk through now as well, it's sort of normalizing treating everyone differently, and I mean that in the good way, like recognizing people's individual needs, taking the time to get to know people, and within the classroom it's really important that other students see that as well, and recognize and celebrate difference. So normalizing the use of communication cards, visual trackers, bringing them into the classroom setting. And also, I guess, thinking around anxiety and things like that as well, using clear, concise language when we're offering to support for people, providing like different options if sort of open questions aren't helpful. If someone's feeling really overwhelmed or they're struggling, asking them an open question, although that's sort of what we're told to do in a lot of ways, I guess that we might need to sort of think about providing more specific options for someone at that point in time. We've also got some sort of like recommendations around like promoting classroom culture. And I guess these are the things that we can use. I use these things within my sessions with young people as well, like encouraging whole class movement breaks, normalize the use of fidget toys and doodling. I know sometimes these things can be seen as distractions, but they can really help people focus in that classroom setting. Providing sort of clear expectations and learning objectives at the beginning of lessons. And encouraging creative approaches to homeworks and assignments that sort of incorporate that universal design for learning, celebrating difference and recognizing that people will have different ways of processing information and will find it helpful to sort of to deliver that information and assignments in different ways as well. There's also some recommendations that we make around environment. So this could, again, I always have a think about if I'm when I'm in a clinical space, I can get put in all sorts of random rooms in health centres or in schools, thinking about what can we do to that environment to perhaps just to think around that sort of sensory checklist. So some good things to consider are, is there direct sunlight coming in? Is that creating like shadows and things like that? What's the temperature of the room like? What's the time of day? Is it just after an unstructured time, like lunchtime, break time, something like that? Is it the afternoon when people are going to be feeling super tired? And paying attention to background noise as well. This can be things like if a projector isn't in use, does that need to be on? Could that be turned off? Because I guess something like the sound of that fan could have an impact as well. And in thinking about sort of classroom layout, we encourage side-by-side learning, and this is a big one, sort of like reducing distractions around key learning points, particularly whiteboards. Obviously, like really colourful displays make the classroom environment, we try and make it more interesting, but actually just around those key learning areas, particularly whiteboards, just keeping that as sort of clear and uncluttered as possible. So I guess some top tips that we have, obviously we make some recommendations that can be quite general about how we can make our settings inclusive, but this is sort of like the minimum that we should be doing. Really, we should be making these, and then also we need to be using individualized strategies and interventions, because we don't want to be taking a blanket approach to inclusion. So we need to be sort of, as Naomi said at the beginning, taking the time to get to know the young person and find out what's helpful for them. Thinking sensory is really, really important. There's lots of sort of sensory checklists and stuff like that you can do for your classroom, like the sort of classroom environment, and also sort of like individually with young people as well. And it's sort of taking that time to take a step back, think about the environment. It's super important, and doing things like sensory checklists with a young person can be great, because they might, if that's been their whole experience their whole life and no one's perhaps had that discussion with them, it's a good sort of a good opportunity to open up that conversation, really. And above all, like feeling heard and understood is amazingly powerful, and listening to a young person and making one simple change can make a big difference to them in feeling included and accepted. So yeah, I don't know if you have anything to add around any adaptations, Naomi.
No, that's fine, Lucy, you can continue, thank you.
Cool. So now going into a little bit more around within our team, what we're doing and the things that we're developing around SEND and neurodivergency. So it's super exciting. We're in the process of developing lots of different things, so in different areas as well. So within schools, we've done a SEND and anxiety workshop. We've done part 1, and that was sort of covering quite similar things that we have done today. It was signed up to by lots of different schools, secondary and primary. People were quite keen to come along to it. And as part of that workshop, it wasn't just like, here's a load of information. What we did is we created action points with schools around like, right, now you've got this information, what are you going to do around that sort of thing? Like, what do you think is going to be useful for your young people? So they created action points, and then in part 2 of the workshop, which we're going to do in around October time, we're then going to do perhaps some more specific aspects of things that they like had given some feedback around, and also given the opportunity to reflect on those action points, what had gone well, what were any barriers or challenges, just so that it's sort of being becoming part of that whole school approach to SEND and neurodivergency. We also deliver a parent SEND and anxiety group, which has been amazing. I'm running another one today, and I've run one over the summer, and I think the takeaway from this, we go through, I guess the focus is around SEND and anxiety, and we provide psychoeducation and strategies and stuff like that. But I'd say that almost only accounts for like half of the group. I'd say like the other half, and actually perhaps what's just as, if not more powerful, is actually these parents coming together and connecting and sharing their stories and feeling heard and feeling listened to. And they have the most amazing ideas of things that they've tried, things that have worked. So I think it's sort of like twofold, that group, and a lot of the parents have stayed in touch afterwards as well. So I think it's sort of helped to develop a bit of a sense of connection and support network. And that was them doing that. That's not us. But I think that's also really important, and something that we think about when we're developing these groups, like fostering that sense of connection. And then we're in the progress, it's sort of going to be like approved and stuff soon, of developing a neurodiversity wellbeing group. So this is aimed at secondary school young people, and it's got some psychoeducation about sort of different neurodevelopmental conditions. We also build in strategies like mindfulness. Each week we explore 2 different senses and create a bit of a sensory profile, just to help young people develop that awareness of their sensory profile. And we talk about some helpful strategies and things that we can do depending on our sort of sensory preferences, sensory sensitivities, lots of S's then. And again, like with the parents and anxiety group, one of our sort of like overarching aims is to sort of create that sense of connection for these young people as well. And this was originally going to be sort of like a well-being and anxiety group, but we've sort of separated those out into 2 separate things, because we want to sort of like, there was too much information sort of thing, and we really wanted that space for young people to feel really like empowered, and that real focus on sort of that general well-being. There's also in the options that some of our practitioners are trained in theraplay, sort of family and one-to-one. So that's something that's also available / in progress. And I guess I'll go on to sort of our future plans in a minute, but I guess something that's really important for our team and our service and for the young people and families is that these adaptations and these groups that we're offering, as well as these sort of interventions that I'm going to go on to in a minute, we don't want to create like a separate SEND pathway within our team. We think it's really important, a bit like Naomi was saying at the beginning, that it's everyone's business. So it's about us all learning how to adapt and be flexible to meet the needs of the young people that we're working with, to make sure that young people aren't waiting longer just because they're neurodivergent and they've got slightly different needs. So we want to ensure that there's that access to suitable therapies and interventions at like the earliest possible stage. So that's why. So it's sort of more like a SEND umbrella than a SEND pathway, but I don't think we've got the maps all sorted yet, Naomi, have we? But yeah, so sort of like future plans for the things that we're developing within our service are mindfulness-based cognitive therapy and being able to adapt that. Some of our practitioners in our team have just finished their mindfulness-based cognitive therapy course. As I mentioned before, the neurodiversity and anxiety for young people is something that's in development. We are looking at an adapted acceptance and commitment therapy group, and also adaptation, so evidence-based adaptations for the psychological therapies workshop. So this is Naomi's, obviously Naomi's PhD is a big part of the future plans of our service because we're super lucky to have her in our team. And also, as Naomi mentioned earlier, like making space for those evidence-based creative approaches, Lego therapy, forest schools, things like that. There are some things that we're quite excited about for the future as well. And I don't know if Jude or Naomi has anything to add about any of the things that we offer. No? Cool. I will hand you over to Jude now. She's going to talk a little bit about some of the experiences of parents.
Lovely. I'm really hoping that you can hear me properly because my internet keeps shouting at me that it's very unstable today, hence the headphones. So we wanted to share with you some of our feedback really from our sessions. So let's have a talk about kind of our parents' experiences. We've had a mixture of positive and negative because, you know, this is the real world we're living in. But we wanted to put some positivity together today. We can show you here, it's so powerful for people to get to know the child. That's the one that is absolutely zooming out at me, because it doesn't really matter what label or presentation or condition that you've got going on. Each individual is going to have their own needs, and whether that's from a sensory a sensory point of view, or whether that is from sort of the level of academic kind of support that they may need. It is all around that sort of individual approach. And this is reflected in the comments. You know, when a teacher takes the opportunity to get to know your child and works with them, you can see the positive influence it has. This beautiful one in purple, our school made our son a social story when he was going on a residential, so he could see where he was going, what was going to happen before he got there. It's all small things that can make a massive difference to the young people that we are supporting. When we work with our parent groups, it can be primary and secondary age children. So, you know, we've got a wide spread of sort of comments here. And I think Lucy's already reflected on this, that the parents' voice that we've sort of collected from our group really show how important it is for them to be heard and to be listened, because really often there can be a real different presentation between what the young person is like at school and what they're like at home. And the power of our the groups has been the parents being able to share their experiences and to be able to share their successes, but also, you know, those things that they've struggled with, and they've been able to support each other. It's not just us as clinicians giving advice and trying to come up with strategies. It's about them having some space and some dedicated time to kind of work through things on their own. So that's kind of our kind of parent voice. Do you want to move on to the next one for us, Lucy? Yeah, so these are some reflections that the schools have shared with us from the workshops that we've already talked about. Strategies to improve the classroom environment. So we have got kind of a lot around the sensory side of the challenges that some of our young people face. Calm and quiet are probably the hardest thing you could try and find in a school, because we know what it's like, whether you've got noisy corridors, you've got noisy classrooms. Schools are jam-packed, they struggle with storage, they struggle with, there's lots of difficulties here that schools are facing. So to try and carve out that kind of calm and supportive space is difficult, but it's essential. So it's one of those things that we're going to have to find a ways around this, and it's supporting schools to help them with that fight, to show them how important that this is, and it is actually essential, just as essential as your textbooks and everything else. You've got your young people have got to be in a place to learn. You need everything, not just the equipment. They've got to be in the right place to learn. So I will, I'll let you read the strategies. I'm sure it's not going to be anything that you're not familiar with if you're working in this area. Effective methods to support our neurodivergent or SEN young people, particularly when they are struggling with anxiety. And I love the fact that this is in bold. Consistency is massive, because whether you're neurodivergent or not, us humans, we like predictability. We like to know what's coming next. It makes us feel safe. So if we can really cling on to a consistent routine, a consistent experience for young people, consistent key staff. I know it's really hard to try and allocate key workers for young people. We know the staffing challenges in school, but if we can give them an option or a raise, and they know who they can go to on what day, that is a really key consistent thing. And I would also reflect that capturing the pupil voice is really, really important, because often what we might consider might be really helpful for a young person might not be what they want, might not be what they need. It's not all about our ideas, and their voice is very, very important too. And then let's have a reflect around the challenges that schools are facing. Challenge around understanding of the condition that the young person has. That feeling that it is a whole school approach. It's not just down to the SENCO to understand what that young person needs. There could be a sort of a lack of understanding of what a presentation could look like in a young person. So I think it's really powerful that however the school words it, the individual support plan or their passport or whatever the wording is, that those are working documents. They're not just a piece of paper that is sort of filed in a school system somewhere, but it's sort of looked at and reviewed experiences in school. There's lots here that we can't do things about. Lack of resources is a massive one. It impacts staffing shortages. It impacts on the environment, not having space. So yeah, there's lots of things that we haven't got a magic wand for, but it's helpful for schools to have the opportunity to share how they've met those challenges, because there could be a nugget of a little thing that one school did that could really work in another. So our school workshops also allow for that sort of sharing of good practice. So that's been really beneficial. So I think we've kind of talked about school staff enough. Do we want to move on to the next one, Lucy? Yay, Q&A. So I'll dip out and hand sort of back to Naomi, and we can kind of navigate this next section. Thank you.
Thank you, Jude. Just on anything that we don't get to discuss, we're more than happy to share any contact details with you. Part of this webinar is not just to give you information, but is to work collaboratively with you across, the country and wider. So if there's anyone that is interested in that or wants to know more or about any of the things that we started doing in terms of interventions, please do get in touch so we can start build those professional working relationships and make sense everybody's responsibility. Thank you.
Great. Thank you so much, Naomi, Jude and Lucy. That was really good. And I think there was some great takeaways, lots of really good tips and resources as well. So thank you so much. I think I've taken away from that, the real need to get to know individual children, young people, taking a personalised approach, working out ways to do what works for them. And that question that you raised, Naomi, why not? We really need to provide each individual with the care that works for them, and lots of good messages about inclusion being everybody's responsibility. So thank you for that. We've had quite a few questions in the chat. Thank you to everybody who's posted those. We've got about a dozen to get through. So we've only got a few minutes left, so I'm going to race through them as quickly as I can. Rather than asking you to pose the questions yourself, I'm going to read them out. So Greg C asked, why is clinical therapeutic practice seemingly quite far behind adaptive practice when this has been happening in schools for decades in the form of differentiation? And then he went on to ask, why can CBT not just be adapted as per the running outside example to demonstrate raised heart rate, as when a practitioner feels the need to? So a couple of questions there from Greg C.
Thank you. Really good questions. We're asking the same question, and I guess that's why I'm in research, is to find the answers to those questions. There is a typical time frame. It takes about 7 to 12 years for evidence-based research to get into clinical practice. That is way too long, and we're hoping by speaking on these platforms and building professional relationships, as I said, with you all, we can speed up that process so it doesn't take so long and we don't have so many children, young people that kind of are lost or slip through the net. But yes, with CBT there is a way to make adaptations, and as part of a follow-on from one of my studies next year, so watch this space, there will be more seminars on developing and adaptations for psychological therapies that are already being used in mental health for children and young people.
Great, thank you, Naomi. We had a couple of posts about fidget toys. So what do you think about reframing the language from fidget toy to focus tool? And there were a few people on the chat saying they're uncomfortable with the words fidget toy.
I think I'm happy for Jude or Lucy to jump in. I think for me, I am uncomfortable with all of the terms that are used at the moment in terms of the language around additional needs. In general, I think we're moving forward in neurodivergent, we're getting there. But in terms of kind of some of the tools or, equipment that we use and interventions, we're still a far way off from great language in that sense.
Yeah, I think there's not maybe, again, like Naomi saying, there's a lot of changes within language as well. I do tend to just use the words that the young person uses. That's sort of what I usually go off. But I imagine if we're trying to
I presume that if they do, they come back with more than one option if it comes to it. And
sorry, I was just gonna say I guess focus tool could be a great way of reframing it in education settings, though. I like that.
Great, thank you. I'm going to quickly move on to the next question, which is from Rebecca Rose, who says, I know every child and young person is an individual and needs vary, but have you got any helpful adaptations that directly relate to the MHST interventions that have been used?
That question was asked just before that slide went up, so hopefully that has been answered now.
Great. And there was also a follow-up from Rebecca Rose about whether you'd be able to share the content of the SEND and anxiety workshop. So that was at the point that Lucy was talking about the workshop for parents.
What we would love, and this is me asking that why not question again, is more than just sharing content. We'd like to share good practice with you and build a relationship. So again, if there is anything that you've heard that you're really interested in and would want to know more so that you can implement it in your service, we'd love to actually have that conversation too as well. So please contact us and we'll go from there.
Lovely, thank you. Fallon Holden asked, when I look into the evidence for use of fidget toys in the classroom, this appears minimal and quite mixed in terms of the effectiveness. Are you aware of any bigger studies which really show that they are effective?
I'm not. Now I'm going to hold my hands up here. It's not. I don't have the time to go deep diving on evidence a lot, But we, yes, we've got the, some evidence that we are using, but this is the reality is that if it's going to help a young person, why not use it? Why not? Whether you call it a toy, a fidget, or a tool, if it's going to make their day a bit easier and help them to be able to sort of function and do what they need to do, I'd be all for it.
Lovely, thanks, Jude. And then we had a couple of questions about mindfulness. So how do you find mindfulness is accepted in the secondary school age group?
Mindfulness and based cognitive therapy for low mood, stress and depression is one of our newer kind of interventions that we've put in place. I am one of the leads on that, trained in MBCT, and we've adapted it. So it was made for adults when it first came out, but we've done an adaptation version of it, working with the mindfulness team who facilitated our training. So it's now used and is child friendly, and a lot of it is again around making things more practical, movement based, and around grounding exercise and things like that, and shortening the sitting tasks. But they are possible. There's just different ways of doing them.
Great, thank you. And I think that answers Angela's question as well about mindfulness being adapted to neurodivergent people. Michelle Handley asked, do you do assessments for the children and young people prior to the group so that you have awareness of their needs or triggers?
Yes, anybody that's going on our groups will have had a full assessment before they're on there, absolutely.
Great. And then we had a couple of questions about the ACT groups. People are keen to hear more, and I'm wondering actually if that's something that we could share by email afterwards, because I'm very conscious that we're pretty much out of time. So if you don't mind, Audrey and Steph, we'll hold those questions and we'll try and include them in the email that we send out after this event. Great. Just to say a huge thank you to the three of you. I'm just going to quickly hand over to my colleague Martin, who's going to tell you a bit more about the follow-up to this webinar. But thank you all very much.
Yes, thank you very much, Naomi, Lucy and Jude. That was really, really interesting. And thanks for everybody that popped a question into the chat as well. So just a bit of follow-up. We'll be sending the resources and the slides in an email this afternoon, and the recording of this session will actually go in an email out next week. In the meantime, if you've got any questions at all about Maiden, please get in contact with one of the team. We'll be very pleased to answer any questions that you have. Over to you, Jen, to finish up.
Yeah, just say again, thank you all for coming. Thank you again to our fabulous guest speakers. We'll be in touch really soon with the next webinar date. If there is something you'd like to see covered, just let us know. We're sending out a short 5-question survey this afternoon with all the resources. Or if you'd like the opportunity to speak, or your team, just either send us an email back or pop a comment in the survey. We're hoping the next webinar will be the first week of December. But we will be in touch ASAP with that. And that's it. Thank you very much. Have a great rest of your day.